which is not a small thing. I'm not saying that that's insignificant. However, it's only used in the hospital setting. My approach is keep the people out of the hospital.
How much success did you have keeping people out of the hospital?
So I saw 2,200 patients with COVID-19. Out of those 2,200 patients, we risk stratified them, and only 800 received the medication treatment.
Okay.
They were the ones that I deemed to be high risk. You would have expected a 5% mortality rate in this country. So you would have expected 40 deaths.
You would have expected 40 deaths, and how many deaths did you end up having?
2.
2. I mean, that's a gigantic difference. What would be the arguments, or what arguments have you heard for your success rate? What are they saying why we can't trust Zelenko's protocol? I mean, is anyone pushing back against those numbers?
The debate is a ideological debate. It's a debate between is empirical evidence or evidence, real-world clinical evidence, valid medical information, or only data derived from a clinical trial considered valid. And this was there was an article printed in the New England Journal of Medicine earlier this year where the conclusion was that only data derived from a clinical trial is considered valid, and anything outside of that is called quote-unquote anecdotal. So my data, according to that definition, is anecdotal. But that's a big anecdote, I have to tell you, because if someone's drowning in the ocean and there's a piece of driftwood, I don't need a clinical trial to tell me that I should hold on to that driftwood. I may get a splinter, but I'm going to hold on to the best available option while I look for better things. So I'm not against clinical trials. I'm just for common sense. For example,
right. Well, and you certainly don't wait and drown in the ocean while you wait for a study to tell you whether or not driftwood is floating as it appears to be floating. You go ahead and grab it because you're in an extreme situation. We are in the middle of an epidemic that every leading expert says they don't understand. Let's be honest, they're saying they don't understand it. They don't understand how asymptomatic carriers work. They don't understand who's giving it to who. One study will say asymptomatic carriers aren't spreading at all. Others will say they are the super spreaders doing it all. I mean, if you watch the news, you could not be more confused or be more sure that science is totally confused. So it seems to me, under those circumstances, with an illness no one understands, that, you know, let me just put it this way. If I am going to a doctor, I would hope that my doctor is attempting to use things that other doctors are saying they're having success with around the world. I do not want a doctor that is sticking to a protocol written by people that are admitting they are totally confused by the illness and are saying just make them comfortable, you know, don't give them oxygen and stick them on a ventilator, which is killing, you know, 8 or 9 out of 10 of them. So you took a different approach. Now, how much have you had discussions with Didier Raoult or other doctors around the world that were using hydroxychloroquine? This is something that what you all question, right? How much interaction is there happening in science around the world? Do you guys talk to each other?
Didier Raoult, I've been in contact indirectly via Twitter or emails and so on. I haven't spoken to him directly, but we have used each other's work he recently started using Zinc, which was a derivative of my work. I was using hydroxychloroquine and azithromycin because of his work. See, medical knowledge is something that evolves with time. We're trying to discover what truth is, and it becomes clearer over time what the best approach is. By the way, I'm not saying that my approach is the best. It's very possible that in some period of time there'll be a better approach, and I would advocate for that. What I am saying is my approach is the only approach right now. Right.
So and 2 deaths out of 800 that are in the high-risk category is an incredibly good result, and I think one that we would all want. Let me ask you this. You know, as we've been watching this story, we watched the FDA. Donald Trump really pushed to get the FDA to give this, I think, emergency use approval. And it seems like nearly around the same time, many states pushed back. Now, I don't live in New York, It's hard to tell what really happened, but it felt like Andrew Cuomo really pushed back against hydroxychloroquine, and hospitals were sort of told, don't use this until really end stage. They're venting. We're in serious conditions. Is that, you're in New York. What was sort of the overall feeling in hospitals around New York? Was it something everybody jumped to, or were people being told really hold off on the use of this drug?
So keep in mind, I practice exclusively in the not hospital setting, the outpatient setting.
Okay,
I can tell you from my perspective, patients were in terror because after the executive order basically limited the ability of patients to have access to this medication, except in the severely sick inpatient hospital setting, people started really panicking because they saw that it was working. It was word of mouth in their families and their friends and so on. So they started actually going to New Jersey, Pennsylvania, Connecticut, and my patients started scrambling to get access to these medications. It was very sad, and it was unnecessary aggravation for patients. It interfered with the doctor-patient relationship, and it really created a barrier in the practice of medicine.
Did you get pushback? Were you called by anybody? Because you were pretty vocal, right? You were really out there as you were starting to see these rates. I mean, it seems like very early on, I heard about you all the way down here in Texas. So was anybody reaching out to you either from government or hospitals saying, you really need to cut this out, this is not the protocol we want to be using, and you're putting people at risk? Was there any sort of interactions like that, or did everyone just leave you alone?
Well, fortunately, I'm self-employed, so I don't have to answer to, I had my own practice, and I don't have to answer to any major hospital system. So I was able to practice medicine in the best way that I saw fit, and I had to answer only to myself and to God. So if the patient agreed and I thought it was appropriate, I would get the patient medication, and with experience making the dosing, and I came up with the right dosing that minimizes minor side effects but has the maximum benefit. So patients were getting remarkable results very quickly, especially if you started within the first 5 days. So
now, okay, go ahead.
So I can understand why there was opposition to the use, because if there is a drug that a company is going to make $3,200 on if the patient's in the hospital, but they're not going to make that money if the patient is at home and healthy, so it's not good for the bottom line of that company. But it's good for the patient, and that's all I care about. I'm trying to preserve the sanctity of human life. I saw so much death and so much misery, people I know and friends, and the pain of the human suffering, that I was just focused on, let's just try to find an approach that works. Trial and error is really work, and you quickly adjust and tweak your.
Let's get into the details of the side effects. Well, first of all, Donald Trump ends up saying he likes hydroxychloroquine, and we saw almost an immediate, it was sort of a friendly, jovial confrontation, I guess we could say, between, Tony Fauci and Trump. Trump saying, I got a really good feeling about this, and Fauci saying, I'd like to see more clinical trials. I'm not so sure. We've even reported on the fact, what was ironic about that moment is, when we later discovered that Tony Fauci knew that they had actually used hydroxychloroquine in studies all the way back with SARS coronavirus and had seen success, documented success as a potential for dealing with coronavirus all the way back in 2005. So I find it a little shocking that he was talking about as though it was the first time and this was a brand new approach to coronavirus, when it really does date back there is some science that dates back quite a ways. But Donald Trump, gets behind it. The FDA gives his emergency use. But now we start hearing about these side effects of heart attacks and things like that. And we've just found out really just a couple of weeks ago that there's two big studies that were begun, the Solidarity trial and the Recovery trial, one at World Health Organization had the Solidarity trial, and then the recovery trial that I believe was at Oxford University. And an investigation in these trials that were supposedly looking at this as a potential life-saving treatment. A great article in Age of Autism that got into this found that what appears to be they were using fatal doses of hydroxychloroquine in the neighborhood of 2,400 milligrams per day. First, since you actually work with it, to begin with, is it fair to call 2,400 milligrams per day a fatal dose? Do you think that is overdosing from your perspective?
Not if you're treating a very fat elephant.
Okay. I appreciate that answer. So then,
I was using 400 a day.
400 a day. Okay. And I believe, if I'm correct, Didier Raoult is using somewhere around 600 milligrams of hydroxychloroquine per day. So in your
using zinc.
Oh, because he wasn't using zinc.
If you use zinc, you need lower dosing.
Interesting. Okay, and so where did the zinc come from? Because we only heard the voice of Didier Raoult. There was azithromycin. Where did the zinc sort of enter the protocol? Did that come from a specific nation or scientist or doctor out there?
They were using it in the Far East, South Korea and China. Okay. And I saw those, some limited studies. It's more the basic science made sense. If the zinc is the virus killer, and you get the zinc to where the virus is, and it kills the virus, it makes sense. It's like a gun and a bullet. I mean, you need both. Having bullets without a gun or a gun without bullets is ineffective. When you have the combination of the two, then it works. So you don't need much of the hydroxychloroquine if you use zinc.
For people that aren't sick yet or out there, you know, obviously we're hearing lots of discussions about this second wave that may be going on, whether or not that's just more testing or not. We could argue that. But for people that are worried, is there any benefit to taking zinc as a vitamin supplement right now? Or does it or is it really only going to be valuable used the way that you're using it?
You're asking an excellent question, which is more about, is there any value to prophylaxis, so prevention? Right. And the answer is yes. And I'm doing work on that right now. I personally take hydroxychloroquine and zinc I have some health issues. I have cancer. I have one lung. And I'm a doctor, and I come into contact with sick patients. So for that reason, to take hydroxychloroquine and zinc. And most of the smart doctors I know take it because they don't want to get sick and because it's so safe. So zinc alone probably has minimal benefit. You need to be able to get the zinc into the cell. There's another option, interestingly enough. It's a natural supplement called quercetin, and it seems to be a similar effect as hydroxychloroquine. So there's not much data on it, so I wouldn't advocate it. But however, if a patient cannot get hydroxychloroquine for whatever reason, or they can't take it for contraindications, I'll use that as plan B.
Got it. Okay, so now let me get into the problem we now have. We have a world divided over this issue, and really, it seemed to me hydroxychloroquine was just going to prove itself out. But because of these trials that are using lethal doses and a really bad study, really, that came out of the VA, where they looked at a very specific group of military people that were already, I think, being vented or in end stage, and they just showed that hydroxychloroquine didn't appear to work. No matter the case, there's been a really strong media push against it. Why do you think the media and everybody have been so prone to want to see hydroxychloroquine fail? What do you think is behind that? I mean, it's not just, Gilead that we know could end up making $3,000 off of a product that can drop 5 days out of a 15-day stay at the hospital.